dose of the treatment.
Okay, sir.
And after the last dose, I want to check how the subject is doing. And after that, I am going to ask him to come to check how he is doing.
Okay. If
Okay,
any
he's going to come one more time to check. Yeah.
okay, if any events or any deviations occur between these,
Yes, so I want to check like if he has got any adverse events, how he is doing. I want to check the next 10 15 days. So I'm going to ask him to come again one more time after the treatment also, and that is called a follow.
if any events occurs
Post treatment, that is post treatment.
and we are going to put that information, sir.
Yeah, generally, whatever the things happen during the follow-up also will consider as an adverse event.
Okay, okay.
Okay.
Is there any special terms, sir, that variable?
There will be no nothing like that. Just we are going to have a follow.
Okay, okay. And we are going to put that information under AE dataset.
Yeah. So from the screening start date to follow-up date, if you have anything, any untoward medical occurrence, we call it as an adverse event.
Okay.
But in that adverse event, if something happened during the treatment, then that is called as a treatment emergent.
Emergent adverse event. Okay, sir.
Okay. Okay. Now, there is a subject called 101. He involved in the clinical trial. So since he involved in the clinical trial, so he started his trial on 2nd of January. Then successfully has completed everything. You know, if anybody involved in the clinical trial, at some point he has to leave the clinical trial, isn't it? After the follow-up, there will be no further contact between the sponsor and the subject. That's it. Follow-up for a complete quality. There will be no further contact. So that means if you are involved in a clinical trial, maybe the clinical trial is going to be 6 months or 1 year. After 1 year, you should leave the clinical trial. Obviously, you are not going to spend your whole life in the clinical trial, right? Maybe 3 months or 6 months or 1 year, based on the duration of the protocol. We are going to spend some time in the clinical trial, and then eventually we are going to come out of that one. Okay. Now, there is a subject called 101. So he started with the screening and he completed the running. Then he started the treatment. He has taken all the treatments successfully, and then he attended even the follow-up also. So I asked him after 20th of April, after the follow-up checkup, I told him if you no need to come again, that the clinical trial is over. So he will not come, and he successfully completed all the phases. Now there is one more subject, 102. Okay, so he involved in clinical trial. So he started the screening, and then suddenly during the clinical trial, okay, he has got a very serious adverse event. Okay, and because of that he got scared and he stopped coming to the clinical trial, and he will not come after that adverse event. Got scared and he stopped coming to the clinical trial, and he will not come after that adverse event, and he stopped there. So he didn't successfully complete it because of some adverse event during the treatment. He stopped coming. Now there is one more scenario. Okay, I have a subject called 103. Okay, and he involved in the clinical trial, and yes, he is taking everything, but suddenly during the clinical trial he met with an accident and he died. Obviously, since he died. And there is one more subject called 104. Okay, and the clinical consultant, connecting in Hyderabad Needs Hospital, and he is enrolled in the insurance, and he is coming for the trial. Suddenly, he being transferred to some other city. He cannot participate in the clinical trial, and he stopped coming. Okay, and there is one more subject called 105. So in the clinical trial, I want him so many times, but he is not following my protocol, and I'm going to ask him, please do not come for the clinical trial, and he stopped that. So as a sponsor, I asked him, please don't come to my trial, because he's doing major protocol violations. He's going to spoil my, safety efficacy analysis. I asked him to, stop. Now there is one more subject. He said, just imagine, this is a diabetic side, and I started giving the treatment. After the 50 days, this person came to normalcy. No, he is no more, anymore. He is not a diabetic patient. He came to normalcy. Am I going to give the treatment? No. Since he met the end point, I'll stop giving the treatment. I'll ask him, please, you don't need to come. And you met with my end point, so you don't need to come, you can stop. There is one more subject. Simply, without any reason, he doesn't want to come to the clinical trial. He lost his interest. He doesn't want to participate in the clinical trial. So, based on his own consent, he stopped coming to the clinical trial. By the way, if anybody doesn't want to clinical trial, you should not force him. That means what you want to understand, what you need to understand here, when a person or when a subject involved in the clinical trial, he may be successfully going to complete the study. Maybe because of so many other reasons, he may stop in between. Okay, once the subject has been involved in the clinical trial, when he is leaving the clinical trial, and why he is leaving the clinical trial, we are going to collect the attendance record, the reason for leaving the clinical trial, he is successfully completed, and when he is leaving. Then is it because of leaving the clinical trial because of adverse event, and when? Because of the death or automobile accident, because of his own consent, protocol deviation, he met with the endpoint, why he is leaving, and when he left the study. I'm going to collect all that information. Now that information, we are going to put it into a data set called disposition, very, very important data set. Disposition means when the subject is disposed from the study, and why. Understand this one? Now, from 3.2 onwards, we have one more domain here. Suddenly, nobody is like, we are transferring a subject. We are moving the subject from one location to another location. So, for example, the subject has been hospitalized in a local hospital, but we do not have a proper facilities there. I want to move the subject to some other location. So, there is some super specialty hospital or something. To transfer it is going to take around 2 hours in ambulance. So, we are going to transfer it in ambulance. When we are transferring it in ambulance, we are going to give some kind of treatment. Isn't it? We are going to take some primary care. We are going to give maybe oxygen. We are going to put like a Holter meter. We are going to record his vital signs. We are going to give some saline or something like that. If we have such kind of information, the ambulatory service. And one more important thing. In India, it is not so common that you are going to spend the time in the hospital and directly you are going to discharge, you are going to come to home. But in some other countries, whenever we have a major surgical operation, in that time we are going to be in the ICU or in hospital. Later, after the surgery has got over, we do not require any medical emergency, but you require some kind of assistance or personal care. In such scenario, they are going to shift you to rehabilitation centers or maybe to nursing home. And if you have any such kind of nursing home or rehabilitation center stays or community services to collect that information, now we have a new domain called healthcare encounters. So we call it as the name HO. HO stands for healthcare encounters. Understand this, everybody? Now, all these domains comes under which classification now? All this comes under events. Now, can you tell me what are the domains that we have in the events now? Most important, we have AE, and then if you have a clinical event, then we are going to have CE, and then before that, the training, we are going to have research play, and then protocol deviation comes under PV, and then
DS.
solution comes under DS, and then we have healthcare encounters comes under HO.
HO.
All this comes under EVENTs. Clear, everybody? Now,
Sir, can you define HO?
healthcare encounters. Healthcare encounters, like the nursing home, rehabilitation, what do you call it? Diagnostic center, ambulatory space, service space.
Okay.
Information comes from the healthcare. Okay, now, during the clinical trial, what we are going to do, to understand the safety of the drug, to understand how we can prove that the drug is effective or not. Anybody? How we are going to prove that the drug is effective or not? How we are going to show the results like that?
Comparisons will be.
Standard versus with the. How we are going to
by results, laboratory results.
Very good. Now, before the treatment, I'm going to collect the samples, okay? And I'm going to run the test. I'm going to get the results. Okay? And after the treatment, again I'm going to collect the samples, and I'm going to run the test, and I'm going to get the results. By comparing those results, we can come to a conclusion whether the drug is safe or not, whether the drug is effective or not. So that means during the clinical trial, we are going to do a lot of findings. Before the treatment and after the treatment, we are going to find we are going to conduct a lot of tests, diagnostic tests, and we are going to find so many things. And if you have such kind of findings, that information we are going to capture into findings plus. This is the most important data for clinical trial. All the interventions, events, special protocol, all the ancillary or additional information, but the most important information is the findings. Okay, but what is laboratory test? There are going to be 10 different types of laboratory. We cannot put all the laboratory tests in one table or one data set. So we have so many data sets now in the findings class. Now, during the clinical trial, what we are going to do, we are going to do a lot of laboratory tests. Like we are going to do chemistry, we are going to do immunology, and we are going to do biochemistry, hematology, urine analysis, so serum analysis. We are going to do a lot of laboratory tests. If you have such kind of laboratory test data, okay, now we are going to write all the laboratory test reports into CRF sheet. Whatever information that I got from CRF sheet, now I'm going to put that information into a data set or a domain called LB. LB stands for laboratory test results. And the next important thing, during the clinical trial, to understand the safety of the heart, during the screening, at a random basis, we are going to collect how do you know that the safety of the heart? How we can understand whether the heart is safe or not? We are going to do ECG tests. We are going to do a lot of ECG tests, isn't it? And whatever the ECG that we have collected, we are going to write all the ECG information onto the CRF sheet. Now that information we are going to put into a domain called EG. EG stands for ECG test results. And during the screening, during the treatment, during the follow-up, every now and then, we are going to collect the vital signs of each and every subject. Because vital signs are very crucial. If the vital signs are normal, everything is fine. If the vital signs are deviating from the normal state, that means something is wrong. So, vital signs are very common. We collect the vital signs information like, heart rate, temperature, height, weight, BMI, systolic, diastolic blood pressure, pulse rate, and the respiration rate. We are going to collect all this information. Now we are going to put that information into a domain called vital signs or VS.
Sir, the protocol will also specify what all the necessary LB tests to be conducted, sir.
Yes, everything is going to be in the protocol.
So the protocol specifies particular tests to be conducted, and we have to follow the protocol, and those similar tests have to be conducted by us, sir.
Right, yes. And according to that, we are going to design a CRF sheet.
Okay, and that information is going to be put under LB domain.
Yes.
Okay, sir.
Now, it is a behavioral study. It is a pain-related study. How we can understand the subject is out of the pain or something? Are we going to have any test for pain? No. So we are going to have some survey questions. And based on that, we are going to collect the data. On a scale of like 1 to 5, how much pain that you are feeling, how much sleep you are getting, do you have any suicidal tendencies, insomnia problem, how much hunger that you are feeling. So we are going to have such kind of inquiry questions. And based on that, we are going to assess the pain management, and that information we are going to put into a domain called QS. So QS stands for questionnaire. Understand this, sir? Now, in the phase 1 particularly, we need to determine ADME concept. Everybody knows I think ADME, absorption, distribution, metabolism, and excretion. And we have to determine the pharmacokinetics and pharmacodynamics concepts. You know about what you mean by pharmacokinetics, right? What is the drug your body is doing to the drug? And what is the pharmacodynamics? How does the drug react to the body? Yeah. So we to collect that information, now we are going to have two important domains. So those are called pharmacokinetic concentrations. That means what the concentration of the drug in the body fluids after giving the treatment. Maybe after 30 minutes, 1 hour, 2 hours, I'm going to collect the samples. I'm going to determine the concentration like Cmax or Tmax. First of all, I'm going to determine the concentration. So based on the concentration, so now I'm going to conduct the pharmacokinetic parameters like what is the Cmax, what is the Tmax, what is the area under curve, all. I'm going to determine all those things. So for those comes under pharmacokinetic parameters or PP. Clear this, everybody? So PP and PC comes under pharmacokinetics and pharmacodynamics.
Sir, will you please repeat PC and PP, sir?
PC means when the subject has taken the treatment, okay? Now before the treatment, what is the concentration of the drug in the body? So for example, I'm given at minus 30 minutes. I think 30 minutes to treatment is on before the treatment, what is the concentration of the drug? And what is the concentration of the drug at 0 minutes? As soon as given the treatment, I collect the sample. And after 30 minutes of the treatment, what is the concentration? After 1 hour, what is the concentration of the drug in body fluids? Like urine, plasma, serum, what are the concentration? I collect all the samples, I'm going to determine the concentration. And then after 2 hours, and after 3 hours, or 6 hours, 9 hours, or 24 hours, 72 hours, depends on the protocol, I'm going to collect the samples at the different time intervals. So now, that information we are going to put into pharmacokinetic concentration. Now by taking the concentration here, concentration on y-axis, time on x-axis, what I'm going to do? Now I'm going to plot a diagram. a matrix graph. Now what is this one? This is called Tmax. And what is this one? This is called Cmax. Maximum concentration and at what time interval that we have in Tmax. And this is called, what is this called? The whole thing? Area. This is called area under curve. Availability of the curve. Based on this, what will you say? What you come to conclusion? Absorption, distribution, metabolism, and excretion. Okay, now we have two domains for that one. BC means pharmacokinetic concentrations. What is BP? BP stands for pharmacokinetic parameters. Clear everybody up to this point? Yes.
Circular. Can you repeat that, sir?
What is the concentration of the drug in body fluids? Tell me if body fluids, serum, plasma, blood, urine. USC stands for questionnaire. We are going to have a survey questions and we collect the questions. Behavioral study, psychological study, pain-related study. You will not have any test for that one. How we can assess that the safety, the efficacy of the drug by asking the questions. We have a certain standard questionnaires. By using the questionnaires, we are going to assess the subject. And that information we are going to put in QS. Okay, questionnaire. Now, whenever the subject comes to the first time, we are going to collect that we are going to look at the investigator is going to look at the examination. If you have any abnormalities, so we are going to put that information in a domain called PE. PE stands for physical examination. Now, how is the tongue, how is the eyes, throat, neck, and we are going to see such kind of things. When the subject comes to the first time, we are going to collect subject characteristics. What are the mental stats of the subject? What are the initials of the subject? What are the origin, which country is from? We are going to collect that information. That information we are going to put into which domain? Subjective characteristics.
Sir, means patient's height, weight, all this comes under P, sir.
That is P, we are going to have only abnormalities like nose, eyes, throat, ENT, endoscopic, rashes, such kind of information we are going to get. And height, weight, sex, all those comes under demographics.
Okay. Means his name, sir, hair, those also comes under P, sir.
Comes under physical examination.
Okay, sir. Means subject characters means his gender, ethnicity, race, all this.
No, those comes under demographics. Subject characters comes under country of origin, marital status, subject initials, such kind of information comes under subject characteristics. Eye color, hair color, such kind of information.
Okay.
Okay. Okay then. We are running out of the time. We'll continue tomorrow. So tomorrow I'll start the class by short 7 o'clock. Please begin by 7 o'clock. Okay. So I'm running out of time. We have another class I need to take. So tomorrow we'll start by 7 o'clock. Okay.
So do we have 8 p.m. classes today?
Today?
8 p.m. classes is it today? Do we have?
From tomorrow we have 8 p.m. from tomorrow.
Okay.
And then we have already class. From tomorrow onwards we are going to have Okay.
I have a question, but I'll ask tomorrow.
Yes, okay.
Yeah, I just have one small question.
Yeah, you can go ahead.
Okay, so like in events, there is a CE, clinical events coming. So you said if it's a diabetic study and the symptoms are like related to diabetic study, then those are captured into CE, right?
Yeah. Yes, okay.
So if that's the case, and the study drug is also related to diabetic study, but if the symptom worsens, even though he's taking that same study drug, now to control those symptoms, I'm sure they would also give patients like the medication related to those symptoms. So in that case, the study drug is diabetic related to diabetes, and the medicine they will give to the subject will be related to diabetes. So that particular medicine, will it be considered as a concomitant medicine, or what is it, like where exactly is that?
That's only concomitant medication because that is not a study medication, right? That is not our drug.
Okay. So even though to maintain the symptoms related to study, and they give other medication, that medication will also go under concomitant, right?
Yes, obviously, it's going to come under concomitant medication.
Okay. Thank you. That's
Okay, that's your thing. Yeah.
Suppose the subject is enrolled in the clinical trial, she is a female subject, and at the time of screening she is not pregnant, but during the clinical trial she got pregnancy.
Okay.
So from the point when she got pregnancy, she will be disposed from the clinical trial.
Generally, during the clinical trial, in the inclusion criteria, we are going to mention, if the subject is pregnant or planning for pregnancy. Okay, so that is my rule. I have in the inclusion criteria. But unfortunately, the subject has been confirmed with the pregnancy. We are going to dispose, and we are going because that is a violating protocol. We are disposing it. We are doing
related information to disposition.
disposition. Okay. Susan, please. I should be voice is very. Can you come again? Sorry, give me the Sorry, absolutely. Unfortunately, I couldn't understand your question. Voice is very good. Can you please explain this question? Okay, that's fine. Okay, then. Yes.
PK parameters, PP domain parameters and the PK concentration means PK and PP parameters.
See, PC is a concentration in the body fluids. We collect the data from the subject, and based on that, we are going to determine the parameter. So PP is always a derived, PC is the observed data. First, we only concentration the subject sample తీసుకుంటాం. దాని basis ranges ఇప్పుడు మీకు చెప్పండి సార్ PC ranges అంటే concentrations తీసుకుంటాం at different time intervals. The ranges are going to put the time on x-axis, concentration on the y-axis. Now, 30 minutes low is my concentration, 1 hour, 2 hours, or 10 hours, 12 hours, 14 hours, 18 hours. This is the cutoff. I'm going to collect all these values. Now I'm going to have a graph. Now, based on this, what we can interpret, where we have the maximum, if here we have, and what I can say, this is the maximum concentration. So this is called Cmax, maximum concentration. At what maybe it is 8 hours or something. At 8 hours we have maximum, so this is called Tmax. And then the maximum time period, this is the maximum concentration that we have. We are going to determine that one by using first we calculate concentrations, then we draw the graph, and then we are going to all the Cmax, Tmax, area under curve, sigma, and lambda, all these comes under what? PP, pharmacokinetic parameters. Okay? Okay then. I see you in tomorrow's class.
Sir,
Yes.
sir, I have some doubts regarding SAS career, sir. So, shall I have a conversation personally with you, sir, now?
Sure.
Okay, sir. Thank you, sir.
Thank you. Okay, guys, I'll see you tomorrow.